My name is James. I'm 73 years old.
My name is Sue, and I am 75 years old.
I met Sue in 1969 in the dining hall at the University of Rhode Island.
Who's the love of my life, and we've been married 51 wonderful years.
I first learned about Huntington's disease at the age of 57. It wasn't my family. My mom had a lot of movements. I decided to get tested. I wanted to rule it out for our children. When I was diagnosed with Huntington's disease, it was certainly a surprise.
I didn't think he would test positive because he didn't have the signs, he didn't have symptoms.
I first started feeling symptoms probably 5 or 6 years after the genetic test. When I first started experiencing chorea symptoms, I had a twitching in my toe, so I could tell that was the start of chorea.
It's difficult to describe the feelings that I felt, and then realizing that this is really happening was kind of sad.
The feet started to move, on the legs and lower body, and then twitching the fingers. So years went by, gradually got worse. The HD chorea affected my independence because of the movements of my fingers. They were gradually getting worse over time. Made it difficult to hit a keyboard accurately. So there is a stigma involved. Always has been associated with movements. They can be embarrassing in public. AUSTEDO has helped me with several of my movements. It has been very helpful. It was pretty quickly that I noticed the results. I do feel more independent. I do feel better that people don't notice.
AUSTEDO has helped James since he started with movements, and he's able to do so many things. And when people meet him, they don't even know he has Huntington's because he doesn't have that movement. Treating chorea early is important. Since James started with the AUSTEDO, I noticed a change in the movements of his legs, which has been awesome and wonderful for both of us.
AUSTEDO is easy to use and stay on over time. It's in pill form. I'm on a few other medications, and I can take them with AUSTEDO.
I would definitely recommend AUSTEDO for anyone I know whose loved one is suffering with chorea and really needs the help to minimize the movements. I got involved in 2006 and I started volunteering and learned about resources and learned about testing where he decided to get tested. And the resources that I learned about really helped with processing the outcomes of his tests being positive. What I would say to people about addressing the chorea symptoms of Huntington's is to have a good care team. You need someone that knows about Huntington's. You need a neurologist who can refer you to the right medications, and definitely have them prescribe AUSTEDO to help them with the chorea.
Since I've decided to seek treatment, life has been better, I would say, overall, because I do appreciate every day as much as possible. You learn that lesson, pretty quickly when they give you the news, so there are things you can do. If I'm talking to someone else with HD chorea, I would recommend that they try AUSTEDO. Certainly speak to their doctor about it. It's an easy to take medication and very effective in pill form.
AUSTEDO XR is a prescription medicine used to treat chorea associated with Huntington's disease in adults. AUSTEDO XR can cause depression, suicidal thoughts, or actions in patients with Huntington's disease. Pay close attention to and call your doctor if you become depressed, have sudden changes in mood, or have suicidal thoughts. Don't take if you have liver problems, are taking risperidone, tetrabenazine, or valbenazine. AUSTEDO XR may cause irregular or fast heartbeat or abnormal movements. Seek help for fever, stiff muscles, problems thinking, or sweating. Common side effects include sleepiness, diarrhea, tiredness, and dry mouth.